This morning. It's actually, as I mentioned a little earlier, the Health and Agricultural Fair that's being put on by the Couva PTALISAS Chamber of Commerce. And to tell us more about this morning, I'd like to welcome Anjenie Jairam, who is the Assistant Secretary and Coordinator of the fair. Good morning to you.
Good morning. Good morning.
Glad to have you with.
Good morning to you.
And I want to say this, I just love this name. I've always loved this name. So Dr. Jairam, who's also an executive member of the Chamber. Good morning to you.
Good morning.
So you've decided to have a grand health and agricultural fair Saturday coming on Sunday.
That's right.
Why? Why
That's
did you choose this?
This is our second health fair. We are adding agriculture because we believe it links. You know, the first one was a health and wellness. Well, basically it's the same health and wellness fair, adding agriculture this year. Because we see the link, which Dr. Rajiv will speak to you about. Yeah, and this begins at the Chambers compound at 7 a.m. with a 5K. Yeah, with a 5K, and this, as I said, starts at 7 a.m. and we are registering. People can pre-register for this.
Okay.
You know, you can call in at the secretariat and pre-register. The first 200 registered folks would get a free T-shirt.
Ooh,
yeah,
nice.
So you pay $20. The fair is free of charge. You attend free of charge, but the registration for the 5K is just $20.
Okay.
Yeah, and you're not just running for anything. You know, based on what is happening with society today, we decided that you know, we've gotten the schools involved. You know, different aspect of the communities and society. So we're running against domestic violence and bullying in schools.
Very good.
Yeah. So that's really the real importance, you know, health, what is happening with our society today. It's very important that we bring this awareness, yeah, and let the community benefit.
What was the first year like? And was there a theme for the first year as well?
Yeah, the first year was a health and wellness fair.
Right.
Yeah, and that, we believe it was successful because, you know, lots of people have called in and said, you know, when are we going to have the other one? And, you know, they're very excited. They've all come back on. In fact, we have doubled this year with the exhibitors. You know, last year we had 20. This year we're going, I think, somewhere around 41.
Wow. Yeah, it is double.
So there is the need, you know.
So that's that part of it.
Yeah.
What about the health aspect of it, Dr. Jairam? How is this going to play out? How's it going to pan out? And are some of the booths going to reflect that as well?
Yeah, absolutely. We have planned for the 2 days several lectures. We try to encapsulate most or what we deem to be the most relevant public health issues that, you know, really, I think, plaguing the population right now. So we have speakers on childhood obesity, metabolic syndrome in adults, which is diabetes, hypertension, cardiovascular disease. Mental health features prominently in the agenda for this year. We have 3 speakers on mental health, and of course tied into domestic violence as well. And nutrition. Well, I happen to be a nutritionist as well. So, you know, public health is all about prevention. And we are looking at the role of NGOs in the community. And I think we are, you know, leading the charge in this regards to the role of NGOs in the community to advocate for public health and advocate for preventative health care. And I think we're going to play a bigger role in the future as a lobby and providing incentive for the government to, you know, really attend to, I think, certain issues that we have been not been making enough strides in. For example, this morning, the Minister of Health, the Honorable Minister of Health, spoke about a reduction in infant mortality in the hospitals, and which is excellent. And at the same time, I think childhood obesity is certainly Right now, I mean, our data, I think, in 2006 stands at 16%, but that's 2006. So what has happened in the last 11 years? I think there's a big question mark there. I think we stand at about probably 20% diabetics for adults, and we're probably wrong about that as well. I could tell you almost on a weekly basis, just in the Couva community, in the health center, we have, you know, patients, cardiac patients coming in 30 years old, 35-year-old with heart attacks and so on. So I think this is a very, you know, in a sense, a bleak situation that we're facing, a bleak health future with regards to chronic disease. And we really need to start looking at the determinants of health. What is it in our society? What is it in our lifestyle that is contributing to this downward trend? Is it our nutrition? Is it our lifestyle? Is it our exercise? Is it, I mean, you know, stresses in society? What is it? What we need is to open a communication, a conversation about this. And the community is going to have to play a huge role in this.
But have RAL studies actually been done? Because, I mean, the last quote that you have is from 2006. Have studies, and I know that it is a problem to get any sort of statistics, any sort of information with regard to that in Trinidad and Tobago. Many organizations are trying to step it up so that we get to 2016, but have any real studies really been done with respect to, you know, child obesity, with health, what causes it? Is it our diet? Is it our lack of health practices? You know, what is it?
Well, I mean, you would think it's kind of mysterious, because the more investment we have in healthcare, and the more tech we have, and the more healthcare companies that come on the scene, things seem to be getting worse, and that's just the reality. But in regards to Trinidad, I think we're flying blind. There's the STEP survey that was done in 2006. And I mean, that data was being compiled from even before that. But I think that you know, the changes in our health situation has outpaced any kind of research that we've been able to do. So right now, no, there's a huge question mark, and I mean, you know, we need to have agency to do that, to study ourselves and see where we're going. So, yeah, no, yeah, and in terms of the diet. In terms of the dietary contribution to health, I think we're still stuck, and you know, I am a nutritionist as well, and I think we're still quite you know, obsessed. The conventional nutritional perspective has been obsessed with saturated fats, and perhaps that has been a red herring in the whole, you know, in the grand scheme of things, because even though we have eliminated saturated fats, to a large degree from our diet, hasn't really had an effect that we expected it to have. What I can tell you from 2006, and it's probably worse now, is that the average Trinidadian has about one vegetable a day to eat, one fruit a day, and probably, and in fact, when you really analyze that data, at that time, I think we were having, on average, 4 days for the week we'd have a fruit. So that means, sorry, vegetable, 3 days for a fruit. So, so I think that's quite abysmal. I mean, where has our diet gone, you know?
Have you found any changes? This is the second year that this fair is running. Have you found any changes with respect to what Dr. Jairam is saying with how our health is unfortunately deteriorating, in light and in spite of all these different things that are coming out, technology, information? Have you found that there's been a change with the participants in the fair from last year till now? Have you found that they've adjusted and tried to be a little healthier?
Well, this would be our second year. Yeah. First, to really judge that, we would look at what is happening. You know, we had about approximately 600 people in the last year, and based on the feedbacks that we have been getting, and the need for having another one, it means that, you know, people would like to get information and stuff so that they can better themselves. You know. So yes, I would say that it is, you know, by having to really repeat this, to get the request to repeat this, I am sure that, you know, it must have created some impact, you know, and you Chamber is very happy to
Be a part of it.
be a part of
What are some of the booths that are going to be there? Because you say it's
Okay.
doubled from 20 to 41 this year.
Yes, okay, so we're going to have various medical testing, obviously medical lectures, healthy food products, which is very important, cardiac rehabilitation, because you know that's a big thing in our country, therapeutic massages, which you know, which is very important to all of us. Medical equipment display, yeah, we're going to have organic products on display, plants, root crops, fruits, you know, various agri-processes, natural skin products, and that sort of thing. We're also having, you know, come on board, we have insurance companies, we have car companies, we have, you know, everybody wants to be a part of this. And we are giving not just the larger corporate companies, but we are giving the moms and pops businesses, you know, an opportunity. So we are going from small, medium, large, giving everybody an opportunity to come on board and, you know, and look,
Be a part of that.
yeah.
So it's catering for everyone.
For everyone.
Mommy,
It's a
daddy,
family-
children,
It's a family
everyone.
affair. It's a family affair. In fact, we are having a bit of entertainment because, you know, when you bring kids along, you know, and even in adults, they like a little entertainment. So encourage them to stick around a little more and stuff like that. So we'll be having
Physical entertainment
physical
for the children.
That's correct.
Which
Yes.
I think Dr.
Very
Jairam
important.
will
It's a
be
high
very
energy
happy.
event.
Yes,
A
yes.
high energy event.
Yes. And you know, we're going to have, as we have here, we're going to have Zumba, karate, aerobics, yoga sessions, you know.
So people should actually walk with their
Of
workout
course,
wear.
of course, because you know, you'll be participating in some of these things. Yeah, yeah.
Fantastic. And children as well.
That's right. That's
Okay.
right.
Now, there's been talk about cutting sugars as well in the diets of children obesity. What are some of the other methods that we can use? As you said, that number has probably risen from, you know, what we had from back in 2006. What are some of the other things that we can tell parents about trying to keep not just ourselves, but especially our children healthy? You know, stop shoving down, you know. As I was seeing somewhere on social media, when your child asks for a certain food product and you say, no, you can't have that, it's really up to the parent to give that child that or not. So you can say no and stick to no and not give in to it. So what, you know, information can you give to parents? What advice can you give to parents on trying to raise a healthy child?
Yeah. Oh gosh, it's a deep issue because kids need kids' food, right?
Yeah.
And actually, no. And I think that's the fallacy, you know, because there's always a kids' meal. There's you know,
Yes.
there's so much marketing
Yeah.
to kids, and I mean, you know, the fact is that healthy food is healthy for all age groups. Certainly, the caloric intake for a child, because of their size, is a little different. They need denser foods than we would eat.
Okay.
But healthy food is healthy food. A healthy food for a diabetic meal, there shouldn't be a diabetic meal. The food that we eat from the time we start eating, which is around 1 year, once we've been weaned and we've gone into a solid diet, it should be a diet that protects that person through their life course, from childhood to you know, their most fertile years, to your elderly, your golden age. And you know, the basis of meals really needs to be fresh vegetables, a good source of protein, and a nice safe carb. And we have the best carbs in the Caribbean. We have root crops, excellent carbs, no gluten in that. So the fact is that yes, you're going to have to cut out sugars, and that should be across the board. It shouldn't be for kids alone. It's just that we've encountered such a crisis with the children that now we're trying to problem solve that. We're trying to have a crash course in that. But for kids, I think one of the myths we should dispel is that kids need, you know, kids' foods. That, you know, a kid's meal.
Yeah.
And if you look at kids' meals in some of these restaurants and they market to kids, you'll see they are trying to get kids addicted to sweets, to fried
Yes.
foods.
Yeah.
We're trying to get them addicted from the start. And trust me, we have that. The addiction has taken root in Trinidad and Tobago.
It has.
You know, as I say, you know, the only place that rivals the popularity of our chicken and chip shops is the local health center. So those are, you know, so you know, we have to try as a society to break an addiction, which is, and it is across the Western world. It's not just us.
Yeah.
You know, and our indigenous diet, contrary to our beliefs, our indigenous diet, and I mean coconut oil is on the rise, is a big star now. And I mean for a long time, everybody thought, well, you know, coconut oil is saturated fat and all these things. So that became a dirty word. But these are some of the myths that we may have to dispel, or we have to start looking into these things. What exactly, which oil is the dangerous oil? These are the things that we'll be talking about as well.
Yeah.
The thing is that the problem is that we don't have concrete answers, or what we can realize is that what we have been doing hasn't been working. It really hasn't been working, you know?
Yeah.
So.
Because we always say that, you know, people long ago lived longer than we are living now.
That's right.
And you didn't hear about all these, the cancer and the this and the hypertension, diabetes maybe.
Yeah.
But, you know, not these other things that you're now hearing that's just affecting everybody
Yeah, infectious diseases.
nowadays. The older people didn't have these issues. So what were they doing different from what we're doing now? What were they putting in their food or not putting in their food that we're not doing with our food now? So we have to look at those issues as well. So this Health and Agricultural Fair on Saturday the 20th and Sunday the 21st of May is going to be addressing all these issues. Right, and it's taking place at the Conference Hall, Camden Road in Couva.
Yes, and the compound. We are using both the hall and the area downstairs.
And the fair itself starts at what time?
The fair starts at 8 o'clock on Saturday morning, Saturday the 20th, and it goes through until Sunday 21st.
Okay.
Yeah.
So it starts at 8 o'clock both times, and
Yes. We're going to give people a little more time on a Sunday morning.
Okay.
So we're going to start off at about 10 o'clock.
okay, a little
Yeah.
later.
Yeah, a little later.
And
we go
close off
until
around.
6.
Okay, great. Both
Yeah,
days.
both days.
And of course, there's the 5K run that takes place before as well.
That's right, on Saturday morning at 7.
Okay.
Yeah, but we ask people to, you know, come out in your numbers. You can, there would be, you know, prizes, cash prizes. There are going to be trophies.
Incentives.
Incentives, yes. And you can come individually, you can come in your groups, you know,
Okay.
however you like to. And it's a run and walk. So it's not restricted to just run.
Okay.
Because, you know, people say run, oh, I can't run, you know. But yes, you can walk because you're walking for a purpose.
I have one